Welcome back to my channel, Mommy's Nursing Care. Today we are going to discuss vital signs topic in fundamentals of nursing. So vital signs is also called as cardinal sign, objective data or overt data. Cardinal sign, another name is for the vital signs, and objective data and overt data we can call vital signs. So vital signs are nothing but the reflection of the changes, the physiological or pathological changes in the vital organs. It reflects vital signs, nothing but it reflects or gives us the signal for the changes in the pathological or physiological changes in the vital organs. What does it actually mean by physiological? Physiological means the normal changes, like normal functioning of the heart. And pathological means if any microorganism, virus or bacteria involves, it may further changes the organic changes. So it depicts, vital signs depicts. So what are the vital organs that are present in our body that may depicts the vital signs? Heart, brain, kidney, liver, lungs, even musculoskeletal system, nervous system. Okay, and these all the things, if any pathological or physiological changes, that will depict or that will shown in the form of vital signs, that is called as vital signs. Vital signs, why vital signs are also called as objective data? For observation, through observation we are collecting the vital signs. Through observation we are collecting the vital signs. That is the reason vital signs or vital sign is also called as objective data. Okay, what are the things that we check in the vital signs? Temperature, pulse, respiration and blood pressure. If anyone asks you what is the fifth vital signs, pain is the fifth vital signs. So temperature, what actually temperature means? Thermogenesis. Genesis means production, heat production, and thermolysis. Lysis means breakdown or loss, heat loss. Heat production and heat loss is called as temperature. Pulse, what actually pulse means? The left ventricle is filled with the oxygenated blood. When it contracts, the amount of the blood that passes through the aorta and through the systematic circulation depicts in the form of pulse. It shows in the form of pulse, and that means when the left ventricle contracts, when it contracts, so the amount of the blood it goes to the left ventricle, aorta, and causes the pulse. And respiration, respiration is the process of exchange of gases. Exchange of gases, what gases? Carbon dioxide and oxygen. The exchange of these two gases is called as respiration, or otherwise in the simple manner, inhalation of oxygen and exhalation of carbon dioxide is called as respiration. And blood pressure, BP, we all say that BP or blood pressure. Even this one is also as equal to the pulse rate only, but it is measuring the how much pressure is there in our arteries. How much pressure is there in our arteries, it is pressure monitoring. Okay, pain, pain is called as fifth vital signs. Pain is called as fifth vital signs. So by using of the pain scale we monitor the pain of a patient, and pain is also known as the definition for the pain is the actual or potential emotional feeling of a person is called as pain. That means, for example, a person is met with an accident, he is feeling actual pain, potential pain. If person's mother or father met with an accident, he is feeling a very bad for that. That means potentially he is emotional feeling of pain, feeling so sad for it. Level of unconsciousness, level of unconsciousness also we called as a vital signs only, because once the person is collapsed we will be checking his level of consciousness. So by using a Glasgow coma scale, by using Glasgow coma scale we check the level of consciousness. Conscious, what actually mean by conscious? If person is aware of time and his surroundings, person means the person is conscious. Unconscious means the person cannot respond to the external stimuli. External stimuli is nothing but if I touches a person, if he cannot feel that touch, means he is an unconscious person. Coma. What is the difference between the coma and unconscious? Yes, there is a lot of difference. If we cannot treat if you did not treat unconscious person, the patient will go into the coma. That means the patient unconscious is nothing but the person totally absent of his surroundings. He himself doesn't know who he is and his surroundings. But whereas this unconscious person, he knows he is in a disease, with a disease condition, or he is in hospital for some reasons, but he cannot feel the touch of a person, or he cannot feel the pain of the pinch. And some people, they may like in the severe stage of unconsciousness or coma, if we bring anything nearby their eye cornea, they cannot even blink their eyes also. That is called as unconsciousness. But whereas coma, the coma person is totally is out of his mind. He doesn't know where he is in, like he doesn't know, he is unaware of himself and unaware of environment, is called as coma. Okay, coming to the even skin color also. Even we monitor skin color. Why do we monitor skin color? Especially at the time of birth. So immediately after birth of the child, we used to monitor the skin color, whether it is a pink or cyanotic color. Pink means the baby is healthy. If it is cyanotic means the lack of the oxygen. Hypoxemia causes the cyanosis. Cyanosis is nothing but bluish discoloration of the body, is called as cyanosis. So that's how we check the skin color of a person. And even those who are anemic, not having enough of blood in their red blood cells in their blood, so they will look like pale. Pale means light, very light pink color. It is like very pale. Even we can see that some people, their face is very white. Why? They are pale in color. Their red blood cells are very less in count. And oxygen saturation, the third other vital signs here is oxygen saturation. That means normal level of oxygen saturation, nothing but the oxygen saturation is nothing but the level of the oxygen percentage in the blood is called as oxygen saturation. So in the infants, children and adults, oxygen saturation is 95 to 100%. 95 to 100% is the normal oxygen saturation in infants, children, adults. Whereas in neonate means the age 0 days to 7 days is called as neonate. So neonate's oxygen saturation we can consider normal as 91. From 91 we can consider as normal level. Pupil reaction also we consider as vital signs only. Why? In case of unconsciousness, we'll have to check the pupil reaction of the person to confirm the death of the person. If pupils are dilated or constricted. Dilatation is nothing but the inner black color inner is whether it is pupil constriction and dilatation is checked with the help of the light, a torch light. If we bring a torch light near to the eye, the people are means like they will constrict if they are active. If they are inactive, the person is dead, means they are like dilated. There is no reaction in the pupil, in the eyes. Okay, coming to the routine vital signs. Routine vital signs means for normal person, what all the things we check first means temperature, pulse, respiration, and BP. In this sequence it comes routine vital signs. But in case of emergency vital signs, for example, person has come met with an accident and the person has come to the casualty. In the casualty we'll have to check the first pulse rate, whether the pulse rate is there or not. Means by checking pulse rate we can confirm that person alive and we can proceed with the treatment. So pulse, respiration, BP, next comes temperature. So the temperature thing we have pulled to the back side. Neonatal vital signs, you all know, after born of a small child, what we all do, whether baby has cried or not. If baby didn't cry, what immediately doctor says, they will make the baby to cry either by pinching or tapping or beating. So why? The first respiration thing comes first in the neonate, whether they are able to breathe or not. The crying is the first indication in the newborn baby whether he is breathing in or not. So that is how respiration comes first, and next one pulse, temperature, and BP. In this sequence neonatal vital signs we'll have to check. So the normal vital signs, what are the normal range of the vital signs? Temperature is 37 degrees Celsius. If we check in the degree Celsius, it is 37 degrees Celsius. And if it is in Fahrenheit, 98.6 Fahrenheit is the normal temperature rate in all our human beings. And if it increases, decreases, the terminology is different. Pulse rate should be 72 beats per minute. 72 beats per minute is the normal, and range is from 60 to 100 beats per minute. 60 to 100 beats per minute. But in case of newborns heartbeat, we can say that pulse rate is also called as heartbeat. It is like newborns is 140 to 160 is the beats per minute is the normal range in the neonate, and it gradually decreases while he is gradually growing up. And respiration normal rate is 12 to 20 beats per minute. Breaths, 12 to 20 breaths per minute is the normal respiration, and it is very 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 important in the examination purpose. It is not 12 to 16 or 12 to 18 normal range, or 12 to 24. It means tachypnea we should say. So 12 to 20 normal BP range is 120 by 80 mmHg is the normal BP of a person, and systolic blood pressure is 120 mmHg, and diastolic blood pressure is 80 mmHg. So for the sake of exam, competitive exam, again it is important. Respiratory depression. After giving morphine is a narcotic drug for the purpose of to keep the patient silent from the vigorous activities. They will give morphine, or in case of anesthetizing also morphine they will give. So after giving morphine, so what happens means it causes respiratory depression. Once we give morphine, we will have to check. Once we have given morphine, we should check for the respiration rate of the person. If it is less than 12 beats per minute, and if it is less than 12 beats per breaths per minute, we should consider it as an abnormal. Immediately we will have to stop the morphine drip and inform to the doctor and we should monitor the patient very closely, because it is a respiratory depressive agent, morphine. And coming to this one, kilopascal and kpl is nothing but the BP 120 by 80. We can also monitor in the kilopascals. That normal range of the BP in kilopascal is 16 by 11. 16 by 11 kilopascals is the normal range BP. 1 kilopascal is equal to 7.35 mmHg. That means according to that one, we have to calculate whether it is a normal or not. 16 by 11 kpl, kilopascals, is the normal BP. So it is the competitive exam again, competitive exam question. What is the normal range of the BP means 120 by 80 mmHg in mmHg. If it is asked in kilopascals means 16 by 11 kilopascals is the normal range, and 1 kilopascal is equal to how much mmHg means 7.535 mmHg is the normal range. So thank you for watching. Thank you very much. Please subscribe my channel and share and like my channel. Thank you for giving me support. And in the next video about the temperature I will discuss.